Hello, my name is Galen Robertson. I'm a mechanical engineer. I've been doing medical research and product design for the past approximately 20 years. And I wanted to highlight for you an important risk that clinicians face when they use syringes for rapid fluid infusion. So push-pull is a common fluid delivery technique that a lot of clinicians use. But what most people don't realize is that the stem of the plunger is actually not meant to be touched, but most everyone does when you pull the plunger back or hand it off to someone else. This is supposed to remain sterile. Any contamination that gets in there will go right across to your patient's fluids. And we're going to do a little demonstration, visualize how easily that contamination can get across the plunger. This is designed for you to be able to recreate at your own hospital if you want to illustrate to others the risks. And if you do make a video, feel free to let us know at 410medical.com. So what I have here is Fluorescein salt, a quarter teaspoon, a small bowl, a small syringe, and then the 20 milliliter syringe that we'll be testing. All right, so you get a quarter teaspoon of Fluorescein, level that off, put it in my mixing bowl. So now I'm going to put 0.3 milliliters of fluid in here. That's all it takes. And now I'll mix that together until the consistency is about like chocolate syrup. Fluorescein is a very powerful dye, so very small quantities will turn water yellow, and even smaller quantities will show up in UV light. It's perfect. All right, so the syringe that we're going to be testing, you do need some water on the inside, and then I just empty it all the way. See the water droplets right there? And that'll make it easy to see the Fluorescein if it gets across. So I'm going to take a drop of this Fluorescein paste and put that on my finger. So what happens is, if anyone touches the ribs of the plunger, and then as you cycle that a couple of times, you can see it's going inside. Every time you move it back and forth, there's a quantity getting across. You can actually see those drops changing color, and these are already changing color. And you can see within 3 strokes, those drops have turned bright yellow. If you're having trouble seeing it, sometimes you can use the UV light. So you can see anything that gets inside that syringe gets across to your patient very, very quickly. It's just getting wiped. If this Fluorescein were pathogenic, this would be quite a serious infection for a patient. I want to point out, syringes just aren't designed for a clinician not to touch this. It's not your fault. We've done simulation studies, and nurses touch this syringe 91% of the time. Almost everyone touches it every time they cycle it. This is a 20 milliliter syringe, so you have to cycle this 50 times in order to infuse a liter into your patient. So you can imagine how many times this gets touched when you're doing push-pull. So in conclusion, it's important to know how quickly contamination can get across this system. This is not an aseptic system. Syringes are designed to be used one patient, one time. Every time you cycle this syringe, you are adding to the risk of infection your patient is facing. And I'd encourage you to try it yourself. Get the materials you need, and you can see for yourself how quickly this happens.